Hello and welcome. You're watching Good Morning India. I'm Rishika Badwa. Let's get you up to speed with the top headlines we're tracking today. Delhi is in a dire situation in need of oxygen. Delhi seen a record surge of 28,395 new cases and 277 deaths in the last 24 hours. Health Minister appeals to the Centre for Oxygen. The GTB hospital with 500 critical patients gets oxygen late last night. Prime Minister Modi addresses the nation gasping for oxygen, gives assurances of the situation getting better but says no lockdown just yet. It is the last option. Maharashtra Cabinet to decide on the full lockdown in the state today. Essential shop timings have been cut to 4 hours a day only. A Mumbai doctor working 24/7 breaks down, says she's never seen anything like this.
With oxygen, and this is not something we are enjoying. हम young लोगों को देख रहे हैं. I mean, we have a 35-year-old who's on the ventilator, and we are not able to help people now. I think ये जो इमोशनल ब्रेकडाउन है हम डॉक्टर्स में अब सबको कोई ना कोई समय हो रहा है because we've not been so helpless. Okay.
Migrant exodus from Delhi and Mumbai begins again. Bus stands, railway stations crowded, have no money or food to stay in the city, said desperate migrants. The Karnataka government orders government land 1 to 2 kilometers outside cities, says it can be allotted immediately to conduct cremations of those who've died due to the COVID pandemic. Well, our top focus story today is the national capital, which has seen a record surge of 28,395 new cases and 277 deaths in Delhi. This is the highest ever so far daily cases and deaths for the national capital. The Delhi Health Minister has sent out an SOS message to the centre saying that there is an acute shortage of oxygen supply across hospitals in the national capital. What we are told is that the GTB hospital did in fact get a supply of oxygen late last night. So Kirti joins us with the very latest. So Kirti, what's happening in other hospitals?
Well, at least as far as GTB Hospital and Sir Gangaram Hospital are concerned, both have received a new stock of oxygen supply. We are being told through sources that even the Max Hospital, there are currently processes that are on to resolve the oxygen supply issue there as well. But there is still a lack of clarity on how long this new stock of oxygen will last, because the problem is not just that new stocks have been sent, but how long can they last? Because that's what Mr. Manish Sisodia, the Deputy Chief Minister of Delhi, was pointing out in one of his tweets yesterday. He gave out a list of several hospitals and said that they have oxygen that would last only for 12 to 16 more hours. Now, this new stock of oxygen that has been sent, could it go on for a day? Could it go on for the next 3 days? That is the big question, and we are still awaiting clarity on that part. And also, of course, the bigger question of accountability that lies upon the government at this point of time, especially the central government, is that is the Delhi government or the Delhi government leaders, do they have to tweet every time when a new oxygen supply is needed? This is a very basic medical resource, and one would expect that at such a crucial time and more than a year into the pandemic, we would have these supplies in place. It is all good that the government repeatedly says that they are importing several metric tons of oxygen or have ordered these many oxygen cylinders. But even in the national capital of the country, if tweets have to go out every time or media flashes have to go on every time to seek oxygen supply and only then cylinders arrive at the hospital, then it is definitely concerning and raises a lot of questions on the health infrastructure of this country at this point of time.
Well, absolutely. Not just the health infrastructure of the country, Sukirti, it also inspires no confidence as far as coordination between the state and the centre is concerned. It's been extremely unnerving for several people to see the health minister, even the chief minister, tweet to the centre demanding oxygen supply. Has there been a breakdown in communication channels? Otherwise, is there no coordination on the ground? Well, the good news that Sukirti is reporting is that at least a few hospitals in the national capital temporarily have seen oxygen supply being restored. How long this lasts and what happens to other hospitals, it's a story we'll continue to track very closely. Appreciate you, Sukirti, for joining us with that update. Now, 28,395 cases, 277 deaths. These are just numbers that Delhi is reporting. Here's a story of the real human tragedy unfolding behind the numbers.
मैंने हाथ जोड़ जोड़ के बेड अरेंज किए थे, हाथ जोड़ जोड़ के अपनी मम्मी के लिए रात को। मैं मोदी जी से पूछना चाहती हूँ, मैं अमित शाह से पूछना चाहती हूँ, बंगाल में रैलियां कर रहे हैं वो, यहाँ क्या पेशेंट मर रहे हैं, इनको दिखाई नहीं देता।
India too witnessed its deadliest day on Tuesday with over 1,700 COVID deaths, its highest ever. But as India's COVID crisis deepens, families scramble from pillar to post for beds, oxygen and answers.
मैं LNJP से यहाँ पे रेफ़र किया था। यहाँ पे रेफ़र करने के बाद सुबह मैं यहाँ पे आया, 3 बजे मेरे पापा को एडमिशन किया। मैंने हाथ पैर जोड़ जोड़ के मैंने कहा ये मेरे परसों की बात है, परसों की बात है, और है ना कहा जाए ना मेरे पापा की डेथ हो गई है।
Suraj's younger brother did not even get a chance to say a final goodbye to his father through a video call.
एम्स गया, सफदरजंग गया, ठीक है, RML गया, भाई GTV गया, सब जगह गया, कहीं ने भर्ती नहीं किया। फिर उसके बाद यहाँ पे आके 4 घंटे रुक जाओ, मैं सुनो 4 घंटे में खड़ा रहा एम्बुलेंस में। एम्बुलेंस वाला कह रहा भाई जब तक भर्ती नहीं करेगा मैं यही रखूंगा एम्बुलेंस। साथ में जाके कोई एक सीनियर आया, उसने कहा चलो इनको अंदर ले जाओ, ज्यादा तबीयत खराब हो रही है। फिर अंदर ले गए। उसके बाद 3 दिन तक 4 दिन तक कोई डैशबोर्ड वाले खबर ही नहीं दे रहे कि कहाँ है पेशेंट, कहाँ पे गया है, कुछ नहीं बता रहे। सुबह से लगे पड़े, कह रहे मेरा डाटा नहीं चल रहा है, अपडेट नहीं हो रही है, एप्लीकेशन नहीं हो रही है। फिर अब जाके SDM आया तो उसने यही लिखा, फिर उसके बाद ले गया ऊपर, और फिर नीचे कोई आया, उसने कहा तुम्हारे डैडी एक्सपायर हो गए रात में। और अब जाके बताया।
Not just that, at hospitals, families patiently camp outside, citing patient care problems.
यहाँ पे अंदर देखभाल के लिए अगर मानता हूँ कि अंदर पेशेंट हैगा, आप उसको जाने नहीं देते हैं, तो अंदर खाना खिलाने के लिए, टॉयलेट कराने के लिए कोई तो होना चाहिए। यहाँ पे मैं संडे के दिन सुबह करीब 6 बजे में आ गया था, सही है। 6 बजे से मैंने यहाँ पे देखा है एक भी पेशेंट ठीक होके नहीं जा रहा है। जो अंदर जा रहा है मैडम, वो मट्टी ही आ रही है, मर रहा है आदमी।
छोटे छोटे बच्चे हैं, अरविंद केजरीवाल से मैं हाथ जोड़ता हूँ कि केयर करो, कि केयर नहीं होती यहाँ पे अस्पताल के अंदर। कोई नहीं देखने वाला, यहाँ कोई नहीं है।
As India continues to fight an unprecedented medical emergency with an already overburdened staff, many grieving families continue to gasp for breath and a bed. With camera person Sushil Rathi in Delhi, Shanakshi Chakravarti for NDTV.
Well, on the Delhi government alleging discrimination by the Centre and Resources for COVID, the High Court said yesterday that if medication was not being sent to places that needed them, blood is on their hands. The High Court told the Centre that enough oxygen was not being supplied to COVID patients in Delhi and questioned whether it could be diverted from industries. The High Court also hit out at the Delhi government over the vaccine wastage. The Delhi High Court, in fact, told the Delhi government to look into the issue of vaccine wastage, calling it bad planning. Also said we're losing valuable time. The Delhi High Court also pulled up the centre, asking why not ban oxygen to industry amid the shortage, said the Delhi High Court. Petroleum and steel industries consume a lot of oxygen. Economic interests at this moment cannot override human lives, heading for disaster. If despite having medication, it is being sent to region A instead of region B, which needs the medication, then be sure blood is on their hands. Please give 8,000 beds for COVID patients in central government hospitals as well. This is what the Delhi High Court told the centre. The Delhi High Court, while hearing the matter, also cited NDTV's report on oxygen shortage in the national capital. Well, the Ministry of Finance, meanwhile, in a decision that was taken, has said that the government has now waived import duty on drugs such as remdesivir injections and other specific inputs. Piyush Goyal, in a tweet put out yesterday, said in line with Prime Minister Modi's priority to ensure affordable medical care for COVID-19 patients, imports of remdesivir API injection and specific inputs have been made import duty-free. This should increase the supply and reduce costs, thus providing relief to patients. Now remember, several parts of the country are in dire need of medical oxygen supply. India is in the middle of a catastrophic health crisis. Hospitals and doctors are now calling NDTV with SOS messages. This is India's worst medical nightmare, and as we speak, several hospitals, even in the national capital, are saying they're left with 3, 6 or 8 hours of oxygen. What happens when oxygen supply runs out? What happens to those patients in the middle of this worst kind of crisis that India is seeing? Well, Prime Minister Modi addressed the nation. He did give assurances, but effectively the takeaway was that there will be no lockdown in place. Here are some of the highlights of what the Prime Minister said.
आज की स्थिति में हमें देश को लॉकडाउन से बचाना है। मैं राज्यों से भी अनुरोध करूंगा कि वो लॉकडाउन को अंतिम विकल्प के रूप में ही इस्तेमाल करें। लॉकडाउन से बचने की भरपूर कोशिश करनी है और माइक्रो कंटेनमेंट जोन पर ही ध्यान केंद्रित करना है। हम अपनी अर्थव्यवस्था की सेहत भी सुधारेंगे और देशवासियों की सेहत का भी ध्यान रखेंगे। इस बार कोरोना संकट में देश के अनेक हिस्से में ऑक्सीजन की डिमांड बहुत ज्यादा बढ़ी है। इस विषय पर तेजी से और पूरी संवेदनशीलता के साथ काम किया जा रहा है। केंद्र सरकार, राज्य सरकारें, प्राइवेट सेक्टर, सभी की पूरी कोशिश है कि हर जरूरतमंद को ऑक्सीजन मिले। ऑक्सीजन प्रोडक्शन और सप्लाई को बढ़ाने के लिए भी कई स्तरों पर उपाय किए जा रहे हैं। मेरा राज्य प्रशासन से आग्रह है कि वो श्रमिकों का भरोसा जगाए रखे। उनसे आग्रह करें कि वो जहां है वहीं रहे। राज्यों द्वारा दिया गया ये भरोसा उनकी बहुत मदद करेगा कि वो जिस शहर में हैं वहीं पर अगले कुछ दिनों में वैक्सीन भी लगेगी और उनका काम भी बंद नहीं होगा। साथियों, पिछली बार जो परिस्थितियां थी वो अभी से काफी भिन्न थी। तब हमारे पास इस वैश्विक महामारी से लड़ने के लिए कोरोना स्पेसिफिक मेडिकल इंफ्रास्ट्रक्चर नहीं था, लेकिन बहुत ही कम समय में हमने इन चीजों में सुधार किया।
Well, the opposition has also reacted to the Prime Minister's speech. Several opposition leaders being severely critical of the government at the moment. Various courts in the country have given directives for lockdown. The people were hopeful that a relief package would be announced by the Prime Minister for migrants, for workers, for poor small traders. But there was no such announcement, said Nawab Malik.
लॉकडाउन से बचे ये सलाह देने का काम उन्होंने किया। दूसरी तरफ देश के कई हाई कोर्ट के आदेश आ रहे हैं शहरों में लॉकडाउन लगाने के। निश्चित रूप से जिस तरह से आंकड़े बढ़े, लॉकडाउन बिना कोई उपाय नहीं, ये परिस्थिति निर्माण हो गई है। हमें लगता है कि जिस तरह से देश में कोरोना की लहर है, लॉकडाउन जरूरत है। केंद्र सरकार को राज्यों को मदद देने की जरूरत है। आम और गरीब मजदूरों को कोई मदद का ऐलान करने की जरूरत है।
Rahul Gandhi, who tested positive for COVID, also took to Twitter to criticize the government. He said India is gasping for oxygen thanks to government of India's incompetency and complacency. Omar Abdullah also took to Twitter to say Prime Minister Modi's address reads as an admission that COVID Wave 1 centralized response, including national lockdown, didn't work. Wave 2 response is now a state problem, further decentralized to Mohalla committees. What a difference a year makes. Meanwhile, tragic and heartbreaking stories continue to pour in from several parts of the country. Here's a story from Uttar Pradesh's Varanasi, where a young man lost his life just waiting for a hospital bed. The mother and the son went from hospital to hospital, tragically to no avail. There was just no room for a non-COVID patient. Well, a similar story played out in Hyderabad as well. Sent back from hospital, a Hyderabad woman died in an ambulance. No one saw my mother. I was completely helpless, said 26-year-old Pradeep, who took his mother from one hospital to another, who rejected the patient. Now, another shocking story that we're tracking from Madhya Pradesh, where COVID deaths are being blamed on oxygen shortage by family members for the second time in 48 hours. 10 COVID patients died at a Bhopal hospital. The family of the patients have accused the hospital of shortage of oxygen supply being the reason. Deaths at People's Hospitals in Bhopal on Monday. Families once again blamed a fatal dip in oxygen supply levels. The government, however, has said that there were no deaths that were caused due to a shortage of oxygen. Well, it's not just Madhya Pradesh and Delhi, it's also Ahmednagar, which is reporting an acute shortage of medical oxygen. There's 2 hours of oxygen remaining across 12 hospitals, according to latest reports. Relatives say that they've been told to move patients out of Ahmednagar to Pune. 700 COVID patients are currently fighting in these hospitals. While the healthcare infrastructure is stretched out thin, listen in to this doctor from Mumbai working 24/7. She breaks down and says she's never seen anything like this.
We have to literally manage patients at home with oxygen, and this is not something we are enjoying. So I really want all of you to follow a few things that I really. अगर आपको लग रहा है कि आपको 1 साल से कोरोना नहीं हुआ है, इसलिए आप कोई सुपर हीरो हो या आपकी इम्यूनिटी बहुत अच्छी है और आपको ऐसे कुछ नहीं होगा, तो आप गलत फहमी में हो. हम यंग लोगों को देख रहे हैं. I mean, we have a 35-year-old who's on the ventilator, and we are not able to help people now. So we do not want, we really don't want any of you to be in that situation. So, sorry. I think ये जो इमोशनल ब्रेकडाउन है, हम डॉक्टर्स में अब सबको कोई ना कोई समय हो रहा है, बिकॉज we've not been so helpless. Okay.
All right, so that there is an emotional appeal being made by a doctor to tell people to be careful and take preventive measures because the healthcare infrastructure in the country is stretched out thin. We're going to slip into a very short break. We'll be back with more news on the other side. Stay with us. Welcome back. Let's get you the big story from Maharashtra. The cabinet is likely to take a decision on a complete lockdown in the state of Maharashtra today. The Maharashtra cabinet met yesterday to discuss the possibility of a complete lockdown, and sources tell NDTV that a 15-day lockdown was discussed. There were ministers who have requested the chief minister for a total lockdown. This is the request that has been put forth by all ministers of the cabinet to the chief minister. Final decision will be taken by the chief minister today. The Maharashtra health minister has in fact appealed to the chief minister to take a quick decision on the lockdown, and the minister also said that the chief minister's decision will be announced today after 8 p.m.
लॉकडाऊन शिवाय पर्याय नाही. ब्रेक द चेन आपण नुसती कागदावर अनेक सवलती देऊन होणार नाही. त्यामुळे कठोर लॉकडाऊन करणं हाच त्यातला सगळ्यात महत्त्वाचा निर्णय राहील. आणि कठोर लॉकडाऊन करण्याचा निर्णय हा उद्या रात्री 8 वाजेपासून घ्यावा अशा पद्धतीचा आग्रह सगळ्या मंत्रिमंडळाने मुख्यमंत्र्यांनाही केलेला आहे.
Welcome back. You're watching Good Morning India. The latest information that we're getting in the Vikas Dubey encounter. Well, what we're learning is that it's a clean chit for the Uttar Pradesh police by a 3-member judicial panel that has absolved the UP police of any involvement. Let's go right across to Vaidya joining us for the very latest. Vaidya, what more can you tell us?
See, this panel was set up last year after Dubey was killed in a police encounter in July last year. So this panel has finally submitted its report to the UP government as well as to the Supreme Court. Former Supreme Court Judge B.S. Chauhan headed this 3-member panel. So in its report, it says that they found no evidence at all to point out any wrongdoing by the UP police. The commission also laments, saying that despite notices given to media as well as the Vikas Dubey family members and others, nobody came forward to give any evidence against the police. But they have got enough evidence supporting the police version given by the villagers. So this report basically even slams the attitude of the media, saying that media went on to say a lot of things, but when we asked them, repeatedly issuing notices, no footage was given to the panel and none came forward. So finally it says there is no evidence to point out anything wrong has been done by the UP police. So it's a completely clean chit, but the point here is, how come no one has come to give any sort of evidence? But the commission clearly details, giving a complete chapter saying that how it went ahead, tried hard to get evidence, but none came forward. It also given recommendations when UP police goes for some sort of search and everything, how they should be well equipped, because in the Vikas Dubey case, they were not well equipped, and 8 of the policemen, including a senior policeman, were killed, and it was alleged that to take revenge of it, Dubey was killed in a fake encounter. So anyway, now Supreme Court will take a final call on this committee report.
All right, A. Vedyanathan there reporting on the clean chit that's been given to the Uttar Pradesh police in the Vikas Dubey encounter panel. They're absolving the UP police of any involvement. Thanks so much for joining us with the details. Let's shift our focus back to the COVID situation in the country. As coronavirus cases surge in Maharashtra, the health infrastructure in the state is overwhelmed. The Maharashtra State Ambulance Control Room is handling 10,000 calls on a daily basis.
Around we received 9,000 to 10,000 calls per day on the control room for various emergencies. It may include the COVID, the suspected COVID patients or the positive patients, and the other emergencies also. The earlier call flow, if we see during the pandemic, the earlier call flow with the accident cases or the pregnancy cases, but now the more cases are for the COVID related symptoms, and we do have the other calls also, like the pregnancy and accidents, but accident cases are relatively less.
Well, and the Maharashtra government is going after black marketers as the police step up action against remdesivir hoarders, a drug where a drug on the basis of which there is a difference of opinion over its usefulness in COVID treatment, but at the same time it is being prescribed in moderate to severe cases and hospitals are running short. As the demand grows, politics continues over remdesivir.
दो अलग-अलग जगह पर छापा मारा गया है, जिसमें ये टोटल 2200 वायल्स पकड़े गए हैं. ये सारे जब्त किए गए हैं और आगे इसका चौकसी और प्रोसीजर औषध प्रशासन कर रही है.
As the shortage of remdesivir continues, more seizures by the police. Meanwhile, distributors of the drug in Mumbai say they are having to turn away patients as the government is regulating the distribution of the drug.
अभी there is a change in system. जो hospital को stock नहीं मिलता है, अभी that has been identified, and now these hospitals will be supplied, which were not getting stocks earlier.
The government has now regulated the distribution of remdesivir and stocks are being allotted to hospitals on a need basis. But the disparity in demand and supply means there simply isn't enough. Distributors say more stocks are expected to arrive in a week after the government's intervention.
कंपनी से स्टॉक जो था हमारे पास, जब तक हमने दिया लोगों को, और अभी कुछ सिस्टम चेंज हो गए और मॉनिटरिंग अथॉरिटी से हो रहा है और जिस हॉस्पिटल में रिक्वायरमेंट है वो उनको अलोकेशन दे रहे हैं। मार्च के पहले तक तो लोगों के कंपनियों के पास जो स्टॉक पड़ा था वो ऑलमोस्ट बहुत बार डिमांड नहीं होने की वजह से एक्सपायर भी हो चुका है और अचानक मार्च एंड के बाद में कोविड का पेशेंट बढ़ने से अचानक इस मेडिसिन की शॉर्टेज आने का सबसे बड़ा रीजन है।
Meanwhile, the politics over the issue continues, facing questions from the Congress and the NCP over how it was able to manage procurement of remdesivir. The BJP today accused the government of trying to earn a commission on the supply of the drug. The NCP and the Congress hit back, alleging black marketing of the drug by BJP leaders.
आमच्या मार्फत होतंय असं कळलं त्यावेळेला अहंकार जागा झाला, कारण या सरकारला लोकांच्या जीवितापेक्षा आरोग्य व्यवस्थेपेक्षा स्वतःच्या अहंकारातच जास्त रमलेत आणि त्याच्यामुळे स्वतः रेमडेसिवीरचं टेंडर मागवून केवळ कमिशन पोटी ते फायनलाइज झालं नाही।
ग्रुप फार्मा के मालिक को बचाने के लिए विपक्ष के नेता स्वयं दोनों पुलिस स्टेशन में जाते हैं। हमारी जानकारी है कि ग्रुप फार्मा की दवा ये भारतीय जनता पार्टी के नेताओं ने लिया, सूरत में भी बांटा, महाराष्ट्र के नंदुरबार में भी 700 इंजेक्शन बांटे गए, लेकिन 20,000 से अधिक इंजेक्शन ये हीरा ग्रुप के माध्यम से काला बाजार करके लोगों को लूटा गया।
As political parties continue to spar over the supply of remdesivir, the BJP throws allegations at the government hits back with allegations that the BJP was actually aiding in the black marketing of remdesivir. But in all of this, the key question is, where are those 60,000 vials of remdesivir that was supposedly being supplied to Maharashtra? With Sunil Singh and camera person Rajendra Dhayalkar, Saurabh Gupta, NDTV.
Welcome back. You're watching Good Morning India. I'm Rishika Baru. Our top focus story continues to remain the national capital, which has seen a record surge of 28,395 new cases and 277 deaths in the last 24 hours. It's a worrying story unfolding in the national capital as far as the supply of medical oxygen is concerned, with the Delhi Health Minister sending out SOS messages to the centre on Twitter. After a late-night SOS, a GTP hospital has been given oxygen last night. Top Delhi hospitals are getting an oxygen refill. A desperate Gangaram hospital has got some oxygen supply. The Delhi High Court has hauled up the centre over oxygen supply to the national capital. Now, Gangaram Hospital has got half its daily oxygen need. The hospital is still awaiting oxygen supply from regular vendors from Uttar Pradesh. It is a UP versus Delhi standoff, an ugly standoff that's playing out right now at a time when Delhi hospitals are in dire need of medical oxygen supply. The Aam Aadmi Party government has said that the UP government is blocking oxygen supplies from UP-based oxygen plants. UP-based Inox is the main oxygen supplier to Delhi hospitals. What really is going on the ground? It is a worrying story that is in fact playing out at the moment. We will continue to get you updates from Delhi hospitals. Remember, the Delhi Deputy Chief Minister, the Delhi Health Minister, the Delhi Chief Minister, they've all been appealing to the central government on Twitter, asking for medical oxygen supply to be restored to Delhi hospitals. Is there a complete breakdown of communication between the state and the centre? This is an oxygen emergency in the national capital. Hospitals saying that they are left with hours of medical oxygen supply. Some hospitals like the GTB hospital, Gangaram, have been given oxygen late last night to refill their supplies, but this is not enough. Top Delhi hospitals are saying that despite the late night oxygen refill, they are still desperate for more. Remember, Delhi has also seen a record surge in COVID-19 cases and deaths in the last 24 hours. The situation in the national capital continues to remain grim. But what is happening? Why is there such a shortfall of oxygen? Is politics being played with people's lives in the national capital? That's the big question. You have the top brass of the Delhi government hitting out at the centre publicly on Twitter, giving sound bites, talking about the oxygen emergency, what really is going on. Srinivasan Jain joins us with the very latest. Vasu, what more can you tell us at the moment? It's a really dire situation with the top brass of the Delhi government appealing to the centre on Twitter. Has communication channel between the Delhi government and the centre completely broken down?
Yes, not just that, Rishika, the main issue is that in all this wrangling, it seems to have really hit Delhi hospitals hard. And oxygen is coming, but it's coming in a hard-fought way, and it's coming literally at the last minute, just as the oxygen supply is running out in these hospitals, which have hundreds of patients, all of whom or many of whom are dependent on oxygen. I just got off the phone with the chairman of Gangaram Hospital as well as officials at Max Hospital's Patpargarh branch. These are two big private hospital chains in Delhi, as we know. The Gangaram chairman told me that they finally got a consignment of oxygen in the early hours of the morning, which was organized by the Delhi government from a private vendor, not their regular vendor, Inox. It reached just in time as their oxygen was running out. They managed to fit this oxygen cylinder or capacity that had come to their systems, again with a lot of confusion and difficulty. Subsequently, they said at about 4 or 5 in the morning, they got another consignment of oxygen from Inox, which is their regular supplier. And that has given them some buffer, he says, for the next day or two. Inox has promised them another consignment of oxygen by the afternoon. But the story in Max Patparganj seems much more dire. They said that they were expecting an oxygen consignment at 2 in the morning. It only reached them at 8 in the morning. Between 2 and 8 in the morning, he said it was an absolute nightmare trying to keep the situation going with all their patients. He said of 300 patients they've admitted, 200 are entirely dependent on oxygen. He said this latest consignment, which has again come from Inox, is less than what they'd expected and is likely to carry them through till the afternoon. After that, once again, the situation becomes dire. So there's a considerable amount of confusion over exactly why the oxygen supplies are getting disrupted, why they're taking so much time to come. The Aam Aadmi Party government says that the Inox plant in Uttar Pradesh has been blockaded by the Uttar Pradesh government. They're not letting supplies travel out. We are hearing, though, from these Delhi hospitals that Inox consignments are reaching Delhi. So it's not entirely clear which of these charges is fully true. But at the same time, the supplies are coming in this last-minute way. Often they're not coming as much as the hospitals would want. So overall, the situation still is extremely worrying, and we'll have to wait and see how this is resolved by all the different stakeholders.
Srinivasan Jain, appreciate you for joining us with that update from Delhi. The situation on the ground is extremely worrying. It's a wait and watch to see how this oxygen emergency is in fact dealt with. Let's shift our focus. Priyanka Gandhi Vadra is in fact speaking. Let's dip in and listen in.
कहा कि हमारी मदद करिए, कहीं ना कहीं से हमें दवाइयां दिलवाइए, ऑक्सीजन दिलवाइए, बेड दिलवाइए, और आप बड़ी बड़ी रैलियों में जाकर हंस रहे हैं। हंस कैसे सकते हैं?
मैम, यही मेरा सवाल है कि चुनावी रैलियों को क्यों नहीं कोरोना छू रहा है, या उन राज्यों में
कैसे कह सकते हैं कि नहीं छू रहा है? कोई जाके चुनावी रैलियों में टेस्ट करा रहा है, कोई चेक कर रहा है कि इतनी बड़ी भीड़ इकट्ठी हो रही है, 40,000 लोग, 30,000 लोग इकट्ठे हो रहे हैं, आपने अभी तक नहीं किया, अब तो करिए, अब तो रोकिए। जब ये संक्रमण इतना बढ़ गया है, आप यूपी के आंकड़े देखिए, 4 तारीख या 5 तारीख से 16 तारीख तक 7 गुना संक्रमण बढ़े हैं। तो इसी तरह से पूरे देश में बढ़ रहे हैं, और जब इतना बढ़ रहा है तब तो रुक जाइए ना।
उत्तर प्रदेश के अंदर लगातार आंकड़े बढ़ रहे हैं, जबकि टेस्ट की संख्या नहीं बढ़ी है। और सबसे ज्यादा जो अभी हम असेसमेंट लगती है, वो ये लगती है कि पहली वेव में ये संक्रमण, ये वायरस सिटीज में था, आज ये देहात तक पहुंच गया है। शायद ही कोई ऐसा जिला बचा है उत्तर प्रदेश का जहां से नंबर्स ना बढ़ रहे हों, और टेस्टिंग ना होने की बात, एडमिशन ना होने की बात और ऑक्सीजन ना होने की बात सामने आ रही हो। तैयारियों को कैसे देखती हैं आप उत्तर प्रदेश सरकार की, और उनके दावों को कैसे देखती हैं? तो वो कह रहे हैं कि हम लोग टेस्टिंग बढ़ा रहे हैं, पूरी तरीके से सरकार मुस्तैद है।
देखिए, उनके दावों के बारे में तो कम ही बोला जाए, क्योंकि उन्हीं का जो सीरो सर्वे है उसके मुताबिक, जो अक्टूबर नवंबर के समय का सीरो सर्वे है, उसके मुताबिक 5 करोड़ लोगों को तकरीबन, उन्होंने कहा था 5 करोड़ लोग कांटेक्ट आए हैं, इस वायरस के कांटेक्ट में आए हैं।
उस समय, और उन्होंने रिकमेंडेशन दिया था कि टेस्टिंग आप एकदम रैंप अप कर लीजिए, ज्यादा से ज्यादा बढ़ा दीजिए। सरकार, यूपी सरकार ने क्या किया? यूपी सरकार ने 70% एंटीजन टेस्टिंग शुरू की। मतलब है कि जो एक्चुअल टेस्ट है, जो आरटीपीसीआर का टेस्ट है, वो सिर्फ 30% हो रहा है आज यूपी में। उस समय उन्होंने क्यों नहीं बढ़ाया? उसको बढ़ाने के बजाय एंटीजन टेस्ट क्यों शुरू किया? अपने आंकड़ों को कम करने के लिए। आज भी प्राइवेट लैब्स में तरह तरह के रिपोर्ट आ रहे हैं हर जगह से कि प्राइवेट लैब्स को कहा गया है कि आप टेस्टिंग बंद करिए।
All right, let's now shift our focus to the story unfolding in Maharashtra. Along with lockdown-like restrictions already in place, more restrictions are likely to come into force. The Maharashtra government has decided to take further steps to cope with the second wave of the pandemic. Ministers have recommended a full lockdown to the Chief Minister and have left the final decision to him. Saurabh, tracking the details of this story, joins us with the very latest. Saurabh, what's the latest that you can tell us? Is a complete lockdown a possibility in Maharashtra?
Yes, it seems a possibility at this point, given the fact that Maharashtra is facing a massive oxygen shortage. Also there is shortage of beds, and states like Maharashtra, when it peaks, this pandemic, the second wave, when it peaks, it's going to be a massive number of cases, because the population here, the density of population here, all of those factors are something that has to be taken into consideration. Now, at this point, what other restrictions are going to be added to the already existing restrictions is something that's still a little unclear, but the government says the officials are working it out. In all likelihood, there's going to be massive curbs on travel, but trains and flights are likely to continue. Government offices are likely to bring down the number of people who will attend office. Also, in other parts of the state, you're going to see is that there's also going to be other restrictions that will come in, including the percentage of people who can attend office. Already private offices have been shut that are non-essential. So this is, of course, in tune with what's happening. But on the other side, there is also politics playing out. For example, over remdesivir, while the AAP government battles the center over oxygen in Delhi. In Maharashtra, here the state government is also having its own battle over supply of remdesivir. Of course, there are differing opinions on its usage, on its in the treatment of COVID. But at this point, there is a demand, and the demand barely meets supply. In fact, it's much less than what the I beg your pardon. The supply is much less than what the demand is.
All right, Saurabh, appreciate you for joining us with the very latest. We'll keep a close watch on the situation prevailing in Maharashtra. Meanwhile, to make sense of India's COVID crisis, Dr. Mayank Somani, MD, CEO, Apollo Hospitals, joins us live from Lucknow. We also have Dr. Professor Ranjan Shetty, HOD and Consultant Interventional Cardiology from the Manipal Hospital, joining us from Bengaluru. Thanks so much, doctors, for sparing your time and being with us. Dr. Somani, if I can begin by asking you, at a time when India has recorded its deadliest ever day as far as the pandemic is concerned, yesterday we saw over 1,700 deaths. We're still awaiting the latest 24-hour numbers. One is also seeing stories of oxygen shortage in several parts of the country being reported. How worrying is the situation on the ground? What's your assessment?
See, obviously these are challenging times, and at this point of time, I think everybody will have to work together to sort out the current requirement and make sure that we're able to provide medical assistance to everybody in one form or the other. Yes, there are challenges, all inclusive, like oxygen, remdesivir, drugs, beds, hospital requirements and everything. But, at this point of time, yes, it's a challenge for everybody. And at this point of time, what we really require is we all get together and make sure that eventually we are able to succeed in making things available for everybody. That's how it has to unfold now.
Right. Dr. Shetty, the Health Ministry, by its own admission, has said that the second wave of COVID is playing out differently from the first in terms of the number of asymptomatic patients needing hospitalization, in terms of the higher proportion of patients facing breathlessness and therefore requiring oxygen. Is this then, directly linked to another variant or to the double or triple mutation that India is seeing?
It's very likely it's linked to a variation, and this is typically how COVID plays out in all populations. The second wave is almost always much more deadlier and much more dangerous. But the problem what we are facing right now is the magnitude. It's the magnitude of problem which we are facing. Even a small percentage, see, the Bangalore right now is reporting around 13,000 cases a day. Even if 10 or 5% of them need bed, that's something which we may not be having right now. So my request to people is to be very careful during these challenging times. Make sure you do not venture out unnecessarily. Healthcare is stretched to the maximum extent possible. There are no beds. There is serious concern about oxygen and drugs. So people need to be more careful during these period, especially for next 2 months. Once the cases starts coming down, things will be much easier. The problem with COVID is always been the magnitude. So if it comes as an isolated incident, it can be easily managed. But the huge number of people who need attention is the worry.
That's interesting. We also have Dr. Subhash Chandra, Chairman and HOD of the BLK Heart Center. Dr. Chandra, it's very interesting what Dr. Shetty is saying. He's saying that in terms of sheer numbers, this is a healthcare emergency that we're looking at, because the number of hospitalizations have also gone up because the sheer number of people testing positive on a daily basis has gone up. Can we therefore say that the second wave is deadlier, or is it just the sheer magnitude of numbers that we're unable to deal with?
Yes, so I would admit that in terms of the scientific logic of having a second wave, it is largely much more deadlier than the first one. We must realize that while the world was getting vaccinated, there were a lot of population which is yet to come for their turn. And the virus had its own method of survival, and that is how the genetic variations in the virus has led to a much more rampant infection and magnitude. Now, my suggestion to cope up with this high numbers is that there should not be a panic in the population. What is happening in case of Delhi is that there is a perpetually shortage of beds being highlighted here. The fact remains that one needs to grade the COVID illness into mild, moderate and severe. There is no need for public to panic with the mild symptoms or even a moderate symptom, where they could be managed even at home or in a simple facility where oxygen inhalation is available. The people try to have a panic and they rush to the hospital, nearest hospital. And unfortunately, Delhi hospital beds are bursting at seams. There are hardly any beds in any hospital and people are desperate. So they must realize that if they have mild illness based on their symptoms or their parameters, they can be easily managed at home in home quarantine, and that's the way to go to deal with this crisis. The situation is really unprecedented, something which we as doctors have never witnessed.
All right, the situation is unprecedented, something that doctors have not witnessed. Dr. Somani, the other big question, of course, is on preparedness. Given the fact that this variant, the double mutation, was first detected in October, we're still only carrying out genome sequencing in less than 1% of India's total positive cases. Should we have anticipated this? Was there any way of better preparing ourselves for this onslaught that we're seeing right now?
See, infrastructure-wise, I think we could have prepared a little better, but eventually one has to understand it's the HR, it's the doctors and nurses, and we can't prepare with doctors and nurses in a year's time for a second wave. We have a certain number which comes out every year, and that's the only way. So, and nobody actually, as a matter of fact, if you look at across the world, nobody was actually prepared for COVID either which ways. Even US, New York, the healthcare system collapsed. So we all know this, and the sheer number is such that I don't think anybody could have prepared well for it. It's just that now at this point of time, we have to prioritize, rationalize, triage, and see what best we can do with the current resources and how can we actually further develop, availability of oxygen and drugs.
Right. Dr. Shetty, would you agree with that assessment? A year isn't enough time to prepare. I mean, of course, you can't double or quadruple your medical staff and your personnel. But what about equipping ourselves with better testing facilities, more number of tests being carried out, or the supply of oxygen, medicines, even vaccinations? I mean, you know, look at the example of the United States. The worst affected country has managed to flatten the curve. They have managed to open up vaccinations for those above the age of 16 in several parts of the country way before India did.
Yes, just to, I would actually agree with the doctor that, we have tried our best and we have been prepared. We have seen how the first wave grew. The testing was difficult at that time. Understanding the disease was, was not very clear. I feel we are much better as far as understanding disease is concerned. For example, our own hospital now, quickly within days we could convert so many beds into COVID bed because we have experience of dealing it earlier. I again stand by my, the previous statement that it's just the magnitude. So if somehow we could flatten,
yes.
The whole concept again is to flatten.
But then, yes. But then I want to give Dr. Chandra the last word. Dr. Chandra, once again, the question that I asked at the very beginning, were we caught off guard as far as the second wave is concerned? Did we not anticipate the numbers to be, like over 1 lakh cases for 6 straight days?
I don't think so, ma'am. This has been a global phenomena, barring countries like Chile and Israel, who were very well prepared in terms of vaccinating their limited population and have been actually ahead of the world. And they have even, they have asked the population not to even wear masks. The rest of the world was caught off guard because of the fact that they were not able to cope up with the vaccination of the population. And given the magnitude of population in India, we were just able to do about a 5% population vaccination in the last 2 or 3 months' time ever since it was kicked in. US is a little ahead of us. So on the other side, the virus had its own way of mutating and, fighting for survival. So virus has mutated, and as a result, we have not been able to detect virus even through an RT-PCR process because of the change in its structure and the kind of illness which it has given the onslaught is unprecedented because the illness affecting more and more younger populations and perhaps more lethal also.
Yes.
So I would not say that we were caught off guard. It is part of a global phenomena, in my opinion.
All right. Appreciate you, doctors, for sparing your time and joining us on the broadcast. It is indeed a worrying situation as far as the COVID-19 crisis in the country is concerned. A story we'll keep monitoring from the length and breadth of India. Short break here on the broadcast. We'll be back with more news on the other side. Stay with us. Welcome back. The top focus story for us continues to remain the dire situation in the national capital as far as the supply of medical oxygen is concerned. Delhi, remember, has reported a massive surge of 28,395 cases and 277 deaths in the last 24 hours. The Delhi Health Minister, the Deputy Chief Minister, even the Chief Minister have been tweeting to the centre appealing for the supply of medical oxygen to be restored to several hospitals. GTB hospital has got oxygen late last night. Several other top hospitals have also been given oxygen supply late last night and in the wee hours of the morning. Let's go right across to my colleague Sukirti, who's tracking the details of this story. She's joining us live from the GTB hospital. Sukirti, what's the situation?
Well, yes, Rishika, we are outside the GTB hospital right now. This is the Delhi government-run hospital, which is one of those hospitals which was facing a severe oxygen crisis until yesterday. We saw the Delhi Health Minister tweet that there are at least 500 patients in this hospital alone that are on oxygen supply. But their supply will last only till about 2 a.m., that is for the next 4 hours. But last night there were oxygen tankers that were sent into this hospital, and the supply is going to last till today afternoon or by today evening. That's the similar situation with Sir Gangaram Hospital and Max Patparganj as well, which are privately run hospitals. Both of them have also received fresh stock of oxygen, but those stocks may last only till today afternoon or till today evening. So what is the long-term plan? The clarity on that is still awaited. On one hand, we have the Delhi government constantly tweeting, constantly tweets coming in from the Delhi Health Minister as well as Chief Minister, who have repeatedly appealed for help to the centre, and the centre now coming into action, sending these oxygen tankers. But the long-term plan, what are the long-term measures, what are the permanent solutions that the government is looking at this point of time, that still remains unclear. On roads, you see these constant ambulances. The patient load has not reduced at all, with Delhi reporting over 28,000 cases and people constantly needing oxygen. Ventilator beds in Delhi are about to finish. They are running in single digits at the moment. So very tough situation in Delhi at this point. No beds available and a crisis for oxygen supply.
All right, so it is an extremely tough situation as far as the national capital is concerned. And Sukirti, you've been reporting on what the health ministry has been saying. The health ministry, by its own admission, is saying that as far as the second wave of COVID is concerned, there are more asymptomatic patients requiring hospitalization, more younger people requiring hospitalization, and there is a need for more oxygen to be given to COVID-19 patients as compared to what we saw in the first wave. Has the situation in several parts of the country escalated to a point that was not anticipated by the ministry? Have they completely been caught off guard?
Well, as far as the Union Health Ministry is concerned, regarding the hospitalizations, in the press conference on Monday, they said that while the age groups have not shifted, people below the in the early 30s or 30s age group, that age group still remains the same level of hospitalizations. But the crucial point being that there are more patients that need oxygen supply. There are more people that are coming with complaints or symptoms of shortness of breath, and that is very crucial. As far as whether they were prepared or not is concerned, at least until 6 days ago, there was a detailed statement from the Union Health Ministry about all the measures that they were taking to increase the oxygen supply. In that particular press note, they had said that based on the number of active cases in the country, we expect the demand to go up until the 30th of April. So they were bracing for peak demand. At least until 6 days ago, they knew that the demand will keep going up till 30th of April. And yet on 21st April today, we are standing outside hospitals and we are telling you that they have supply only till today afternoon or today evening. So definitely the question lies of accountability at this point of time, that until 6 days ago, if there were projections that the demand is bound to go up till 30th of April in several states, then why was the Union Health Ministry not proactive enough? Yes, 50,000 metric tons of oxygen being imported, many cylinders being ordered, but yet we are not prepared. On ground, people are struggling.
Well, more questions than answers really, Sukirti, and if this is the situation that we are reporting from the national capital of the country, one shudders to imagine what it's like elsewhere. And there is a shortage of oxygen supply that is being reported from other parts of the country as well. Now, the other shocking aspect, Sukirti, of this story has been the fact that the top brass of the Delhi government has actually been tweeting SOS messages to the centre. What really is happening? They are alleging that oxygen is not being supplied. Is there politics that is being played? Is the supply chain from UP dried up? What's happening?
Well, Rishika, if the statements had just come on Twitter or in press conferences, one would have said that there is a political blame game. But here another significant fact remains that this is not just being said over Twitter or in media interactions, but this is also being said in the High Court. In the Delhi High Court, the Delhi government is officially filing affidavits, officially filing statements, telling the judges there that yes, supply is being diverted to bigger states. They did not want to name UP government over there, but the fact is that the accusation remains that the supply is being diverted to Uttar Pradesh by certain private suppliers who were supposed to send the stock to Delhi. Now that is the allegation they are making even in court before the judges. And as a result of that, the Delhi High Court also reprimanded the centre. They said that you have to take the measures now. People can't keep waiting for oxygen. But of course, we will have to speak to hospitals as well about where exactly is this new supply coming from. Is it coming from those suppliers that were allegedly diverting the stocks to Uttar Pradesh, or this is being supplied from the centre? So the portion and suppliers remains unclear, but definitely Delhi government also making these similar allegations in court as well.
Well, absolutely. And, the Delhi High Court has taken cognizance and said that, blood is on the hands of those who are diverting whether it's medicine supply or oxygen from region A, even though region B needs it the most. So that's, of course, very strong words that came in from the Delhi High Court as well. We'll keep a close watch on the situation in the national capital, but patients being discharged due to lack of oxygen in Mumbai is a huge story that's emerging as well. There are complaints that have been reported. 3 days ago, 168 patients from 6 hospitals of the BMC were sent to other facilities, reportedly due to the oxygen crisis. Now, the BMC has taken some steps to address this issue. The first oxygen express went to Visakhapatnam to return with oxygen supplies for the state, but is it enough?
Are hospitals in Mumbai discharging patients quickly due to the lack of oxygen? Sohail Bhai Reshamwala, who runs an NGO, has tried to save patients by providing oxygen support. He says he has seen people losing their lives in front of him.
हॉस्पिटल वाले बोल रहे हैं कि हमारे पास ऑक्सीजन नहीं है. जिस तरह से दवाई वो लोग दवाई लिख के देते हैं प्रिस्क्रिप्शन में, वैसा उस तरह ऑक्सीजन अभी प्रिस्क्रिप्शन करके लिख के दे रहे हैं. दिस इज व्हाट इज द पोजीशन एट प्रेजेंटली दैट वी डोंट हैव ऑक्सीजन. और मैंने जीते जी देखा हूँ, जो कि हम थोड़े बहुत छोटे बहुत सोशल वर्क कर रहे हैं, 2-3 पेशेंट हमारे विदाउट ऑक्सीजन एक्सपायर हो गए हैं और हमारे आंखों से देखा है. इट इज़ अ वेरी बैड पोजीशन एट प्रेजेंटली.
कंपनीज हमको सिलेंडर्स नहीं दे रही हैं, रिफिल नहीं है, गैस नहीं है. पेशेंट्स रोते हैं, हाथ जोड़ते हैं, भैया कुछ तो करवा दो, कुछ तो मिल जाएगा हमको सिलेंडर पर, हमारे पेशेंट्स बच जाएंगे. ऐसे हालात है इस समय हॉस्पिटल्स में कि पेशेंट्स हाथ जोड़ते हैं डॉक्टर की, भैया डॉक्टर हमारे हॉस्पिटल से मत निकालो, हमको यहाँ रहने दो. डॉक्टर्स मजबूरन ऑक्सीजन ना होने की वजह से, किल्लत की वजह से उनको डिस्चार्ज कर दे रहे हैं. हमने मैन्युफैक्चर टीम से बात किया, लोकल अथॉरिटी से बात किया, बीएमसी से बात किया, पुलिस स्टेशन से बात किया, लेकिन कहीं कोई अपना कोई साथ नहीं दे रहा है. सब जगह यही बोल रहे हैं कि भाई किल्लत है, किल्लत है.
The BMC has also confirmed that 168 patients from 6 hospitals of the BMC had to be sent to the Jumbo Center and other alternate places due to oxygen shortage. Since then, steps have also been taken to save the available oxygen. In Mumbai, daily supply of oxygen will now be monitored through Google Drive. For the transportation and distribution of oxygen from the production site, municipal teams deployed in COVID hospitals will monitor the movement. Instructions have been given to use the available oxygen stock accurately and sparingly, especially in private hospitals. The BMC has also said that about 300 tons of oxygen is expected to be received from Visakhapatnam, Jamnagar and Raigad. The first oxygen express left Mumbai with empty tankers for Visakhapatnam. It will return to Maharashtra with medical oxygen to provide relief to patients for whom it's a matter of life and death. With Pooja Bhardwaj in Mumbai, Saurabh Gupta, NDTV.